Whenever you have drugs that are mind-altering, people are going to use them. So that doesn't mean we shouldn't do something about it. I'm just saying that they're always going to seek out mind-altering substances, so alcohol, illicit drugs, or the misuse of prescription drugs in this case. One of the ways to reduce that, in my opinion, is to make sure you have responsible patients who understand the risks here and also the seriousness of taking a step to opioid medications. And two, just not flippantly prescribing these drugs. I mean, we have to do the evaluations that I talked about earlier. Having said that, I do think we have problems with certain types of physicians that are writing these medications without doing the evaluations that I discussed and writing very large quantities, and these people need to be stopped. Also, we have it is a huge market. I mean, people are making a lot of money diverting these medications, and there is a huge black market for these, and these are being produced down in South America, and they're being brought up here and sold on the street. Obviously not pharmaceutical grade, but sold on the street. So it's important to understand, too, that physicians aren't the source for these medications. They come from other places as well. And one particular place, for example, Dr. Dave Jorgensen and Aaron Gilson got some information from the DEA, and they found over, and I can't remember the exact data, but they found over a 5-year period there were millions of units stolen from pharmacies in just half of the U.S. That's all they could get data for. So millions of units of opioid medication were being stolen from pharmacies. I mean, these end up on the street. And so there are other sources for this, and we need to somehow try to plug up some of those other sources as well. It's not just a physician problem, and I think we miss that in a lot of our efforts to reduce diversion.